So we're going to have a slight change of gear as we come towards the end of this stage this morning. One thing that fascinates me about the infrastructure sector, those who are here for my opening talk, was how complex and expensive it can be. And one thing we're not very good at in the sector is looking at other sectors for inspiration for how we simplify complexity and solve big problems in a scalable way. I've always been fascinated by the healthcare sector, how they can deal with such complexity on a life and death basis in actually a really, really simple way. So we're going to change gears slightly and talk to somebody at the forefront of medical research and medical technology and seeing what lessons can be drawn from that sector. We're going to talk to Dr. Atul, who is Chief Medical Officer at Philips, and he is going to be interviewed by Susana, who's the Portuguese Bureau Chief. So please give them a warm welcome as they come to the stage.
Hi, I'm very excited to be here. Today we are going to talk about healthcare and how we can turn complex problems into simple solutions and learn about high-tech answers to healthcare crises. With me on the stage is Dr. Atul Gupta, as the Global Chief Medical Officer of all diagnosis and treatment businesses at Philips, which is a worldwide leader in health technology. Atul wants to make healthcare more accessible, inclusive, and connected. He supports Philips innovation and new product development, and he helps define Philips' future in health innovation and vision using game-changing technologies such as artificial intelligence, cloud, robotics, automation, and augmented reality. Welcome, Atul.
Thank you, Susana, and welcome Web Summit, where we talk about what I consider to be the most important topic, which is our health.
Yeah. By the way, I thought that Philips was like a consumer electronic company.
Yeah, Philips has been a consumer electronics company. We're a 130-plus-year-old company, but we're really in the same business now as we were over a century ago, which is the innovation business. But you are right. About 10 years ago, Philips pivoted, and now we are a pure health technology company. Everything that we do is around the diagnosis and treatment of disease, and increasingly we're using all sorts of digital health tools to help make us all healthier. That's what Philips does. And as you can see, I'm also a doctor.
I see it.
And I also still practice, and what I am is an interventional radiologist. I do image-guided therapy. Do you know what that is?
No, no idea. I'm sorry.
That's okay. I'm going to tell you.
You will tell us.
Image-guided therapy is just a fancy word for what I consider to be modern-day surgery. What we do is procedures that at one time used to be done with surgery, and now we can do it through minimally invasive techniques. Let me give you an example.
Yeah.
You know, surgery goes back thousands of years.
Yes.
But for almost all of that time, it required us to cut you open to see the disease. But now, thanks to imaging, things like CAT scans and MRIs and ultrasounds, I can see inside your body, Susana, without opening you up. So that's why we call it image-guided therapy. But that's just the imaging.
Yes.
That's half of the equation. The other half of the equation is the therapy. I also have access to miniaturized devices, sensors, implants, angioplasty balloons. And I can treat you without opening you up. So at Philips, what we're doing is
amazing.
we're coupling the imaging to the therapy, and that's why we call it image-guided therapy. And that's why we can treat you for things like strokes and aneurysm, replacing cardiac valves, killing cancers, fixing backbones, through incisions not much bigger than a pencil point. And that means patients can go home sometimes even the next day. It's pretty incredible.
Wow, that sounds pretty incredible, in fact. So tell me, Atul, which are the main challenges that healthcare is facing today?
I think that healthcare faces a whole bunch of challenges. And I don't know, I have some slides up there, and I'm hoping that they can actually change it to the next slide. But I'll tell you, two of the biggest challenges that we have are patients are getting older. Disease is getting more complex. Patients are getting sicker.
Yeah.
I see this everywhere go around the world. In fact, I was in Japan recently. You know, it's one of the oldest countries on earth.
Yes.
30% of the population of Japan is now over the age of 65. Here in Portugal, the Portuguese society, I was also in Italy a couple of weeks ago, 25% of the population is over 65.
Yeah.
If you live in London, if you live in the UK, guess what? 500,000 Brits are now over the age of 90. So well done, modern medicine. We've done a great job keeping people older, but that comes with challenges, a lot more complex disease. So that's the first challenge. The second challenge that we're facing is that we have staff shortages. I don't care what country you live in, you can open up your headlines and all you hear about is doctor shortages, nursing shortages, ambulance worker shortages,
Yes.
technology shortages. Here in Portugal, 1.6 million people do not have access to a general practitioner. That's crazy. Doctors are going on strike. You've reported on this. You know, just a few months ago, the physicians in emergency departments said they will no longer work 18-hour shifts. They're begging and pleading to work a 12-hour shift.
Yes.
Now think about that. Only work a 12-hour shift. This is not sustainable. In the UK, there's over 100,000 unfilled positions in the National Health Service. And in my country, in the United States,
Yes.
50% of doctors, they're burnt out, 65% of nurses. So Susana, I don't think that we're going to recruit our way out of this mess. We're not going to find the 15 million healthcare workers that we need by the end of the decade. And that is why digital health tools, things like AI, AR, VR, robotics, automation, they're going to be the key to success.
So those are huge challenges. So Atul, tell me, how can technology like AI, robotics, augmented reality can help us to overcome those challenges, please?
Let's just take one disease by example. Let's talk about stroke.
Yeah.
Okay? Every 2 seconds somewhere on Earth, somebody has a stroke. It's the #1 cause of disability in the world. It's the #2 cause of death.
Wow.
Now, this is a young audience. I see people's eyes glazing over. You're young. I like to think I'm young.
Thank you.
But let me just tell you something. 1 in 4 of us, if you're over the age of 25, which most of us are, 1 in 4 of us will have a stroke at some point in our life.
Oh, but that's
that makes
scary.
it very
Yeah.
personal. In fact, we have an expression. We say time is brain. Seconds count. You're losing 1 million neurons, brain cells, every minute a stroke is in progress. Think about that. It's like having a hard drive, and every minute you're losing pictures and photos and documents. So time is of the essence. Why? Because we now have access to minimally invasive procedures where I or other doctors can navigate little catheters up into your brain, extract that little clot, and if we do it fast enough, not only can we freeze that stroke, we can actually reverse it and get you back to good health. We can treat it. How is technology helping? Already today, there are startups that are using things like computer vision, apps in your phone where you can look at the phone while you're at home if you think you're having a stroke, and the app will scan your face, and it will help triage you as to whether it thinks you're having an ischemic stroke, activate a stroke team, and make sure you go to the proper hospital. Also, we're using things like artificial intelligence. So once you get to the hospital, you're going to get a CAT scan. Now, that CAT scan will be interpreted almost instantly by AI, and it's telling me whether or not you have what we call a large vessel occlusion, that clot in the brain. Why? Because seconds count. And if before you get off that table, we have an early indication that you're having a stroke thanks to AI, it automatically activates the stroke network, the nurses, the doctors, the intensive care unit, shaving off time, saving neurons. And then, of course, we have augmented reality, as you can see on this screen. You know, augmented reality is going to have a huge role, certainly for interventional procedures. Your body, it's a 3D structure. Okay. Today, I'm looking at your body on a 2D screen. Now I can navigate my devices in a hologram. And that potentially may make it faster and safer. But also, we can extend access to care with things like holograms. We can beam in experts with telepresence. These are things that we're exploring in Philips, trying to increase access to care, giving me a second pair of eyes from an expert continents away. But it's not just augmented reality giving me a second pair of eyes. We also can give a second pair of hands. We're exploring the use of robotics. which we can potentially have a physician in Lisbon or in London or in Los Angeles treat a patient for stroke continents away because we don't have enough people to do this. So I think that all of these digital health tools are going to revolutionize the way we take care of stroke. But that's treatment.
Yes.
Wouldn't it be better if we can prevent the stroke?
Yeah, but it sounds amazing, everything. Oh, what's that?
Take a look at this. So this is something that we call an e-patch. This exists today.
Okay.
This little device you can wear.
Very
it's a wearable.
small.
It's measuring a whole bunch of vital signs. It attaches to your chest, just like that.
This.
Patients put it on their skin, and they can wear it for weeks at a time, and it's constantly monitoring your vital signs. And it's looking for things like atrial fibrillation, which everybody's familiar with. Why? Because if you have atrial fibrillation, even a little blip that might be 2 seconds, it significantly increases your risk of stroke. So we want to catch people that have atrial fibrillation so that we can make sure that they don't have a stroke. Now, this thing is monitoring you for about 2 weeks. There's been a study that came out last year in the European Heart Journal.
Yeah.
It turns out that if I look at that 2 weeks worth of data as a human, I look at your EKG, 2 weeks of your EKG. If I don't see a single blip of atrial fibrillation, AI can see something I can't. AI is able to predict, even if there's no atrial fibrillation, that you are more likely to have a stroke in the next 2 weeks with 75% accuracy.
Yeah, wow.
Now we're changing from treatment disease to predicting disease. And that's the power, I think, of AI.
All this sounds amazing, and even for me, like, difficult to believe, as we were like in a future movie like a Star Wars or something like that, but this is reality. But anyway, I feel that when we talk about high-tech and healthcare tool, I feel that we are talking about the US, Europe, Japan, but what about people who have problems, who struggle to get access to healthcare just because they live in remote areas?
It's a fantastic question, and I happen to think we can walk and chew gum at the same time. You are correct, Susana. Mm-hmm. Sadly, your zip code, your postal code, that's actually more important in some cases than your genetic code. You know, where you live shouldn't determine whether you live.
Yeah.
And let me give you one example. Let's talk about pregnancy and childbirth. Okay, you know, every 2 minutes, a pregnant woman dies during childbirth. Even today, and that's preventable. You know, oftentimes, almost all the time, 95% of the time, that's happening in low and middle income countries. Why is it? It's because they're not getting a fetal ultrasound. The World Health Organization says that every woman should have a fetal ultrasound before 24 weeks of pregnancy. But it's not happening. So, how do we make that happen as Philips? Well, one way we can do it is to miniaturize our equipment and get ultrasounds to places that don't get them. I think we all know what an ultrasound is. You know, it's like this big, gigantic refrigerator box that attaches to a probe, and then you can scan patients with it, and you can see the fetus. So one of the things that Philips did is we've shrunk down that entire refrigerator box into just the probe. So we call this a Lumify. This is that entire ultrasound.
Nothing. I'm going to just stand up because I got jealous.
And
this is awesome, eh?
And we call it Bring Your Own Device.
Yeah.
So, for instance, if you look on the screen, you can see in Kenya, somebody can bring their own iPad or their own mobile phone. They attach it to this, and that is the ultrasound. So now we've miniaturized the ultrasound, and we've given them access to care. Mm-hmm. But that's not enough. If I had given you this probe, and I said, Susana, I want you to scan that pregnant woman, and I need you to tell me how many fetuses is she carrying?
Yeah.
Is it breech? Where's the placenta located, which will mean is she going to bleed? What's the amniotic fluid? What's the fetal heart rate? And I want you to do that in 5 minutes. Can you do that for me?
Yeah, well, how?
And that's the problem.
Yeah.
It's not just about giving equipment. Who's going to do the scan? Who's going to interpret the scan? And that's where AI comes in. So Philips has partnered with the Bill and Melinda Gates Foundation, who recognized what we were doing here. And what we've done is we've added AI to this Lumify technique. So now, with just 6 sweeps on a belly, in about 2 minutes, I can train you to do this scan, and it will automatically give you all of those pieces of information.
Yes.
It's things like that that are going to increase access to care. And when I say access to care is not just in low and middle income countries. We have an access to care problem in the United States, in Brooklyn. We have an access to care problem on islands, remote islands. We have an access to care problem in maternity deserts in the United States. I think tools like this are going to significantly increase not only the quality but the length of life, and it is not just for wealthy nations.
I see that this can really change many people's lives. This is like a very exciting and interesting topic to talk about. I could be here for hours listening to you, Atul. But I see that here in our audience, a lot of people in their 20s and 30s, that maybe they are just wondering, what can I do for healthcare? How can I help? So what would you say to them?
Well, I would say that we need your expertise in things like artificial intelligence, computer vision, augmented reality, robotics, cloud, to help us achieve our vision at Philips, which is to improve the lives of 2.5 billion people a year, including 400 million people in underserved countries. So actually at Philips, almost 50% of our research and development people are actually in the software side of things. Mm-hmm. Software has become a very big part of what we need. So yeah, we absolutely need the competency that exists in this room. And I'm super thrilled and excited about digital health and this generation. But, when we query adults, when we talk to adults, 69% of older adults don't believe in AI for healthcare. When we ask the same question to millennials and Gen Z like are here, I think this generation not only embraces AI, but they expect it. And you can help us create it. You can help us create that future of healthcare.
Wow. So are you optimistic about the future of healthcare?
Yeah, but I think that there's one thing I also want to comment on. I hate to break the news to you.
Yeah.
You're a sandwich generation. I'm Gen X.
Yeah.
We're over the hill.
Okay.
You guys out there, millennials, Gen Z, I hate to break the news to you. You guys are also over the hill. You guys are always saying, bye, boomer. Honestly, move over, millennials. Have some Z's, Gen Z, because it's all about Gen Alpha. Gen Alpha is the next generation of digitally native people that we also engage with at Philips, because they were raised in an environment that's purely digital. All they know is swipe to open on an iPhone. They know Snapchat. They know AR. They know voice recognition and gesture, brain-computer interfaces. They are going to be the people that take care of me and you. And that is why we bring those kids who are now teenagers into our innovation labs in the Netherlands, in Asia, in the United States, and we stick them into our operating rooms. And we get very interesting insights. So I'm joking. I do think that Gen X, Gen Z, millennials are important, but it's also looking to where the puck is headed, and we engage heavily. I think that you asked, am I optimistic about the future of healthcare? I think that digital health tools, things like augmented reality, AI, automation, they're not going to replace physicians. They won't replace journalists.
Yeah.
But they are going to give us superhuman powers. They're going to help me diagnose and treat faster. They're going to help me not just treat, but also predict and prevent disease. And yes, like you indicated, they will increase access to care. So I think I'm super excited about the future of healthcare. I think that it's our vision that everybody gets care, the best care, no matter where they live on Earth. So stay tuned, Susana. Stay tuned, audience. The next 5 years in healthcare are going to be very exciting, and I can't wait for you to see where we go next.
That sounds very comforting for me, and also I'm sure that for our audience, Atul. So, thank you very much for this amazing talk. Thanks to your audience, and I really hope to see you soon. I'm very sad that the Web Summit is ending today. So thank you.
Thank you very much.
Thank you. See you soon.